All Americans will be affected by what Congress and the President finally decide, if anything, about health care reform. Our lead story tonight is about the specific effect it may have on those who use the health care system more than any others, the older Americans. We begin with this backgrounder by our medical correspondent, Fred DeSam Lazaro.
Okay, can you take some really deep breaths?
Elderly Americans are by far the biggest users of the nation's healthcare system. Almost all of them are covered by the $150 billion a year federal Medicare program, a program as sacred to many as Social Security. Medicare is largely funded by payroll taxes on all Americans, and its annual costs have been rising at double-digit rates in recent years. That's just one reason seniors fear it may become a target in healthcare reform.
But they better not take away any of our Medicare that we have.
Says they won't.
Well, it's in the paper they might.
All right, I'll talk to you later.
Take away our Medicare. I mean, some of it to give to somebody else.
Clinton administration's healthcare proposal does not trim any of Medicare's current benefits, but it does scale back future growth in Medicare spending. The fears of seniors, even if unfounded, are real, as is their political clout.
I don't think they understand what's going on, and it's just too bad.
Few lawmakers can forget this ambush of Congressman Dan Rostenkowski in 1989, after he voted for a measure that raised Medicare premiums to pay for catastrophic health insurance. The persistent opposition by groups like the American Association of Retired Persons led to the measure's repeal a year later. From the outset of his campaign for health care reform, President Clinton has courted senior organizations.
Well, I'm glad I'm here in Florida for spring training because while the baseball players are working on their swings, I came to tell you that I'm still in Washington going to bat for you, and I will every day. I am the President of the United States.
At rallies from Florida to New Jersey to the Midwest, the president has tried to reassure seniors they'll be well cared for under his reform proposal.
There are a few major plans before the Congress now. Only one of them proposes to keep Medicare strong and makes it stronger. That's our proposal.
The present Medicare consists of two parts. Part A covers hospitalization. Medicare patients pay a $700 deductible each time they're admitted for a new complication. The rest, and it's frequently thousands of dollars, is paid by the program. Under Medicare's Part B, seniors pay a deductible of $100 a year, plus 20% of their doctor or outpatient bills. Medicare pays the other 80%. The total package costs each senior about $41 per month, far lower than the premium for any similar commercial insurance. Still, co-payments and deductibles often add up, so many elderly Americans purchase private insurance to cover them, so-called Medigap policies. Those below the poverty line may be eligible for this type of insurance through state Medicaid programs. Medicare and most other policies it's combined with still leave two major expenses uncovered: long-term care and prescription drugs.
Prescription drugs are too expensive. They're terrible. Our expenses are $400 a month for medicine. So,
Medicare doesn't cover those obviously.
No.
The Clinton health plan would add significant prescription drug coverage under Medicare.
We save money in our health care system if people who need medicine get it and can therefore stay out of hospitals. You can spend a year's worth of medicine in 3 days in a hospital.
The president's plan does provide for some long-term care. It would not cover the expensive nursing home care, but would pay for in-home care, assisting people with daily living tasks like eating, bathing, and dressing.
How valuable would you say that is?
Very good.
I know several people who have to go into the home because they have nobody to help them at home to take care of them. And if they had someone to come in a couple hours a day and help them, they wouldn't have to be in a nursing home. And a nursing home is very costly today. They're probably $3,000 a month or more.
The president proposes to pay for these added benefits by slowing Medicare's near double-digit inflation rate for savings of $120 billion by the year 2000. It likely would mean smaller reimbursements for doctors and hospitals. This financing mechanism has many critics. Some question its feasibility, and others, even those who would benefit, its consequences.
If you do that enough, a lot of these doctors don't want to bother with Medicare patients then, if they can get a larger reimbursement. And I don't see, at least from my doctor, that they're being reimbursed that much. They pay, it's $22 for an office visit is what Medicare allows them to charge. So I hope that that part won't get changed that much, because if they cut that too much, it's going to make a difference.
Do you think in your situation, your doctor would say to you, I'm sorry, I can't see you any longer because it's just not worth my while?
No, I don't think he would say it that way. But it might be that if he were at one time say, well, come back in 3 months, they might make it 6 months now.
Worry about the proposed cuts in Medicare's growth is one reason the American Association of Retired Persons has yet to fully embrace the Clinton health plan, even though it addresses most of their major concerns. Most seniors we talked with are not just worried about healthcare reform, but also the process by which it's enacted.
I don't think all of us understand the complete plan, but it seems that no matter what they try to do, there's too much opposition coming from all sides. They're always trying to knock down everything before it even gets started.
What has started is the legislative jockeying between the various reform proposals in Washington. Senior organizations say for now they'll await the outcome before throwing their support to any plan.